Insulin pens are a convenient way to take insulin. They have revolutionized the way people manage their diabetes, offering a blend of simplicity and efficiency. They are small and easy to carry, fitting seamlessly into your daily life. Whether you're heading to work, going for a walk, or traveling, an insulin pen can be a reliable companion. This makes them a good option for people who are always on the go. You can discreetly manage your insulin needs without drawing much attention. Insulin pens use a pre-filled cartridge of insulin, which simplifies the process of measuring and administering your dose. You can use them for different types of insulin, whether you need rapid-acting, long-acting, or a combination. This flexibility is crucial for personalized diabetes management. Insulin pens have many parts, including the needle, cartridge, dose button, and dose window. Each part plays a vital role in ensuring accurate and safe insulin delivery. The needle is what goes into your skin. It's designed to be as painless as possible, making the injection process more comfortable. The cartridge holds the insulin. It's pre-measured to ensure you get the correct dose every time, reducing the risk of errors. The dose button releases the insulin. With a simple press, you can administer your dose quickly and efficiently. The dose window shows you how much insulin you are taking. This feature helps you keep track of your dosage and make adjustments as needed. Insulin pens are very useful for people with diabetes. They offer a convenient and effective way to manage blood sugar levels. They allow for precise dosing and are more discreet than traditional syringes. This can make a big difference in your daily routine and overall quality of life. Always consult your doctor to determine if an insulin pen is right for you. Your healthcare provider can guide you on the best practices and help you choose the right type of pen. It's important to learn how to use your insulin pen correctly. Proper training ensures you get the most benefit from your insulin therapy. This essay will teach you how to do that. Let's get started. By the end, you'll feel confident in using your insulin pen effectively and safely. Before you can use your insulin pen, there are a few important steps you need to follow to ensure it is properly prepared and safe for use. You need to prepare it carefully to ensure accurate dosing and to avoid any complications. This includes attaching a new needle and priming the pen. First, wash your hands thoroughly with soap and water. This will help to prevent infection and ensure that your hands are clean before handling the pen. Then, remove the cap from the pen, exposing the area where the needle will be attached. Next, take a new needle from its packaging and remove the protective tab to expose the needle. Twist the needle onto the pen until it is tight and secure, ensuring there are no gaps. Now you need to prime the pen. This step is crucial to ensure that the pen is ready for accurate dosing. Priming the pen will remove any air bubbles that may be present in the needle or cartridge. Dial 2 units of insulin on the pen to prepare it for priming. Hold the pen with the needle pointing up to allow any air bubbles to rise to the top. Gently tap the cartridge to move any air bubbles to the top of the pen. Press the injection button until a drop of insulin appears at the needle tip, indicating that the pen is primed and ready. Your pen is now ready for use. You can proceed with your injection, knowing that your pen is properly prepared. Now that your pen is prepared, it's time to move on to the next step. You can inject your insulin. This process is crucial for managing your blood sugar levels effectively. First, you need to choose an injection site. The right site can make a big difference in how well the insulin is absorbed. Good injection sites include your abdomen, thighs, and the backs of your arms. Rotating sites can help prevent skin issues and the backs of your arms. Make sure to avoid any areas that are bruised, swollen, or have scars. Once you have chosen an injection site, clean the area with an alcohol swab. This helps to prevent infections. Let the area dry completely before injecting. This ensures that the alcohol doesn't enter your body with the insulin. Next, dial the correct dose of insulin on your pen. Double-check the dosage to make sure it's accurate. Use your thumb to push the injection button all the way down. This will release the insulin into your body. Keep the needle in place for 10 seconds after injecting. This helps to ensure that the full dose is delivered. This will ensure that all of the insulin is injected. Counting to 10 can help you keep track of the time. Then remove the needle and dispose of it properly in a sharps container. Never reuse needles, as this can lead to infections or other complications. Proper storage of your insulin pen is crucial to ensure its effectiveness. Keep unused pens in the refrigerator. Avoid exposing them to extreme temperatures or direct sunlight. Always check the expiration date on your insulin pen. Do not use expired insulin. It is important to rotate your injection sites. This means injecting in a different spot each time. Remember, this guide provides general information. Insulin needs vary. Always follow your doctor's instructions for your insulin dosage and injection technique. Subscribe for more intriguing content.